Good morning. The class is about quality assurance in radiology. So quality assurance is nothing but a series of procedures that are done in order to ensure the optimal and consistent operation of the equipment that is used in radiology so that the produced radiographs are of high quality. So there is a protocol that is given for these series of procedures that have to be done, and those include both the quality control tests as well as quality administration procedures. First, if we see the benefits of the quality assurance, it is mainly to improve the diagnosis and to reduce the radiation dose to the patient for time saving and cost saving, and also for more reliable equipment function. So generally, as we encounter a number of errors in the radiographs, so that can be, most of the times can be a processing error which can be done by an operator, but most of the times that can also be because of the equipment errors. So in order to prevent these, few steps are to be taken and few procedures are to be done to ensure that the equipment is functioning properly. So as we said, this is divided into two types: quality control tests and quality administration procedures. So quality control tests includes those that are done for the X-ray units. So like processing for the processing control to assess the functioning of the X-ray inputs, and to assess the functioning of the view boxes, the cassettes that are used in radiology, and for darkroom safe lighting. So there are also few assessment protocols given for digital X-ray units, which include solid state sensors, phosphor plates that are nothing but those used as sensors in digital radiography, and also to assess the digital monitors. So all these comes under the quality control tests. As we said, there is something other called as quality administration procedures. So the quality administration is nothing but assigning the personnel that is present in radiology different responsibilities so as to take different procedures, to conduct different procedures to ensure the equipment quality and functioning. So those include, as said, the assigning responsibility to personnel, and also to provide proper training to the personnel that are present to perform all these procedures. So as said, there is a protocol that is given to ensure the quality in radiology. So those includes daily tasks, monthly tasks, weekly tasks, and yearly tasks. The daily tasks includes, first of all, comparing the radiographs with a reference film. A reference film is nothing but a film that is taken with wherein with a fixed parameters of exposure as well as with optimum conditions of the processing solutions, that is using the fresh solutions. So at the start of the day, a reference film is taken, it is processed, and it is kept as a reference film on the view box. So next, the series of radiographs which will be taken in that day will be compared with the reference film so as to see that the density and contrast of the film is maintained. So this is about the reference film. The other a procedure that can also be done includes using sensitometer and densitometer as well as step wedge test. By using sensitometer and densitometer is a device which helps to take the radiographs at a calibrated light pattern, and these radiographs are processed, and a densitometer is used after processing of the films. The densitometer is used in order to calibrate the density and contrast if they are optimum for that film. So any change in the density readings, it is from day to day indications said to be a problem, and that has to be corrected. Next is the step wedge test. For this, either an aluminum step wedge can be used, or the lead foils which are present in the film packets can also be folded and made into a step wedge pattern which can be placed upon the unexposed unwrapped film. So now this is exposed and processed so that we do get grayscales of various patterns as seen in this picture. So as seen in this last picture, so different grayscales will be seen on the film after processing. So this is again taken as a reference film. Likewise, after changing the solutions, that is changing it to the fresh solutions, processing solutions every day, or after replenishing the solutions every day, so as the radiographs that are reference films that are taken in the first day, they can be stored in a refrigerator for further use, and every day at the start of the day they can be processed and kept as a reference film for use for the whole day. So that is about step wedge test. So these are made in order to ensure that the density and contrast of the film is maintained. The other one includes entering the retake log. See how many quality assurance procedures we do. There might be sometimes there might be slight errors or the faults that we get in the radiographs. So that needed the repetition of the radiograph again. So these repetitive radiographs should be entered in a retake log so that they can be reviewed in further reviewed for further days, and those mistakes should be noted down so as to not to repeat those mistakes. So this is about enter findings in retake log. Next is replenishing processing solutions. So at the beginning of each working day, the level of the processing solutions in the water tank should be checked, and if they are less, the solution has to be replenished. Also, the temperature of the processing solutions should also be checked every day, and they should be taken care that the temperature is maintained optimum. That is, for manual processing solutions, it should be at 68 degrees Fahrenheit, whereas for heated automatic processors, it should be at 82 degrees Fahrenheit. So that is about the daily tasks. Next is about weekly tasks. So every week we have to replace the processing solutions. So after repetitive use, they get contaminated, the solutions get contaminated, or and they get contaminated and depleted. So they need the replacement. So every week the fresh solutions has to be replaced. So before replacing these solutions, the tanks that contain these processing solutions should be cleaned. If they are manual tanks, they should be clean. If they are the automatic tanks of automatic processors and of automatic rollers, they have to be cleaned according to manufacturer instructions. Next are cleaning the view boxes. So view boxes are very important in analyzing, interpreting and diagnosing the radiographs. So we should always check the view boxes if for the presence of any cracks, for the presence of any scratches on the view box, and also the light that is present in the view box, so that we can ensure that the quality of the diagnosis is maintained. Next, review the retake log. As said, in the daily tasks, we are entering the repeating radiographs, right? So those should be reviewed every week. Next are the monthly tasks, which includes checking the digital sensors, checking the photostimulable phosphor plates. So these photostimulable phosphor plates are mostly used in the digital radiography. So they should be checked for the presence of any scratches or any damage to the plates, so that if there is any such damage present, they should be discarded and replaced with newer ones. Next is checking the dark room safe lighting. So this is very important in order to ensure that we are processing the films at optimum conditions to get a quality radiograph. So this can be checked either visually or using few tests. So visual check is nothing but switch off all the lights in the dark room and visually check for the light leaks in the dark room. So if you find any light leak from any point, so mark it with a chalk or mark it with a marker, and later on we can seal it with a tape. So that is the visual analysis. The other test that can be used includes penny test, which is the common test that we generally used. So place a coin on it. First of all, switch off all the lights in the dark room. Then take an unwrapped, unexposed film packet and place a coin or a penny, say penny, on the film packet and leave it for 2 to 4 minutes. So after that, process this particular film and check for presence of any image of that coin. If you find any image of that coin, that means the safe lightening is not safe enough. So if you don't find, the safe lightening conditions are good. If it is not, the safe lightening is not safe enough, there might be some problem with the distance of the safe light from the processing equipment, or the bulb may be damaged, or the filters may be damaged. So they have to be checked and are to be replaced. Next is cleaning intensifying screens. As we know, intensifying screens are used in the cassettes that are used for conventional extraoral radiography. So these has to be cleaned and are to be checked for presence of any scratches, debris or any marks on the intensifying screens. Next, rotate the film stock. So every month the film stock should be rotated. That is, the old stock should be used first and the newly procured stock should be placed for the later use. Next, checking the exposure charts. That is, so every day as we are taking the radiographs, we are using various parameters, the MEA, KVP and exposure time to do this. So all these should be entered and we should ensure that there is no much difference in these exposure parameters. So for that, to ensure, we have to check the exposure charts. So most of the times the KVP is fixed, but the MEA and exposure time can be varied according to the person, according to the patient, according to the size and according to the location that we have to take the radiograph. So accordingly there are various exposure time that is given for various areas. Next, checking the lead aprons and collars. So the lead aprons and collars should be checked for the presence of any damage. So in order to prevent such damage, they should be nicely hanged onto a hook on a handrail. So any damaged equipment should obviously be replaced. Next includes the yearly tasks. Yearly tasks include calibrating the X-ray unit. Okay, so this doesn't need the frequent checking. Only if there is any problem that we encounter in the equipment, we can make the personnel come and check the unit, or else annually we can calibrate the X-ray machine. So this calibrating the X-ray machine includes checking for the stability of the tube head, checking for the collimation and filtrations, and checking for the focal spot that is present, that is checking for its size, whether it is increased or reduced, and also checking for the X-ray output. We can use dosimeter, a device that can be used to check the X-ray output. So next is checking the digital sensors. So digital sensors are used in the digital radiography like RVG and OPG, which is digitalized now. So for all this, the digital sensors are used mainly in the RVG. So these has to be checked. The assessment includes investigation of any significant deterioration in the quality of the radiographs. So recording all investigations together with identified cause and action taken, and regular annotation of image quality should be recorded, and subjective assessment of quality of each radiograph should be done. If there is any change in the quality of the radiograph, then we should check the sensors and we should replace them, or either make sure that there is no problem encountered for further radiographs. So as said, the sensors that is used in the digital radiography includes CCDs and CMOS sensors mostly. So these should be checked regularly. Also the phosphor plates, photostimulable phosphor plates or the PSP plates that are generally used, they should be checked for the presence of any scratches or damage to the plates. And they should be ensured that there is no problem encountered in getting a good quality radiograph. Next is checking the monitor. So this needed a test pattern like TG18QC, which is a test pattern that is designed by SMPTE, generally designed by AAPM, which is based on the original SMPTE test pattern. So the monitors to be checked based on this software system, and the quality assurance calibration should be done so as to ensure that we are getting proper digital images on the monitor with proper density and contrast conditions. So that is about the quality assurance that is done in both digital units as well as the conventional units. We should always ensure that these procedures are done in order to ensure that the quality of the radiograph is maintained.